Well, your time now is 11:20. We are joined by local dentist, Dr. Brad Beasley. We're talking about something to protect our smile, protect our teeth, healthy gums.
Sure. Well, Dave, one of the most important conditions that we screen for in dentistry is gum disease or periodontal disease. A couple of reasons why it's so important. One, it's the leading cause of tooth loss in the country. And
how common is this?
Well, that's another good point. About 80% of the adult population are affected in some form or another with this.
Why?
Well, it is such a common problem for us to have bacteria in our mouth, and there's certain types of bacteria that are harmful that cause the gum recession, cause the loss of bone, and we all have that bacteria. And it's easily spread from person to person.
You've brought some drawings to show just how serious this problem is, or what happens if you have periodontal disease.
Sure. Well, this graphic here, it just shows the tooth, and it shows the actual probe instrument that we use to measure the bone loss. And what we're actually doing, I'll hold that up just, okay, there we go. You can see the probe coming into the side of the tooth here. And basically this is a healthy condition. You can see the bone that's right here on each side of the tooth, and it's healthy. It comes all the way up to the neck of the tooth on each side. But when we come over to an unhealthy condition where we have bone loss on each side, you can see basically the probe goes down much deeper. And when it does, we have destruction of the bone over on this side here. And when we lose the bone support, the teeth begin to get loose, and we start to have spaces between our teeth. But so many times, this is a silent condition. You can see up top how the gum tissue starts to recede back, and the teeth become looking longer and having the spaces. And it's the condition or the signs that we have are usually the hidden ones. Maybe a little more frequent bad breath, maybe a little more bad taste, and those things that we sometimes ignore. And the screening, where we take that probe and get numbers around each tooth, really help us to quantify the condition of the disease and how advanced it is.
If it's caught early enough, like with so many other illnesses, diseases, is it reversible? Well,
gum disease is always a condition that a patient will have, just like if you're diagnosed with diabetes. You're not going to, there's no treatment that will be like a magic wand to totally reverse it.
Right.
But we can stabilize the condition and many times prevent additional bone loss.
When you say that you stabilize, so if we've still got some of that disease, and obviously we've got some of that periodontal disease in our mouth, what is life like if it's caught early enough? I mean, obviously, you said it's not reversible, but what's the rest of our life like with our teeth?
Sure. Many times we can use the different treatments, such as anti-infective treatments, where we're using medications to kill the bacteria, because the bacteria are what cause the bone support loss. But laser treatments, DNA testing can be done to exactly nail which bacteria are causing the problem for that particular patient and treat it. But you can keep your teeth the rest of your life if you seek the proper treatment.
And that's the most important thing.
That's right.
For anybody. Now, if you want to get a hold of Dr. Beasley, it's very easy. We got a graphic, we can put that up. You can find him at Beasley Cosmetic and Dental Dentistry, or General Dentistry in Athens. There's the phone number to call, 256-233-1400.
Great.
We thank you so much.
Good to see you again. Thank you. Good to see you, Dave.
Hope to see you before the holiday.
Thank you. You
All
too.
Right.
You too.
Stay with us. Meteorologist Keller Watts has another look at your Friday forecast right after this.